know how to work the system, how to get in there, how to ask the right questions. So I would say it's really just doing research, right? Looking at different positions, and I'm just going to do a plug for LinkedIn, even though they're not paying me. But I spent a lot of time on LinkedIn back then, and even till now. I would go in, look at job descriptions, read on positions, look at people's profiles that are in the same position that I want to be in, and look at how they got there, high level, and then I would read. I still have my textbooks. I still have a lot of things that I just reference to try to understand, so that when somebody asks me a question, I may not have all the answers or even the right answers, but I would know what they're asking me. So, and then as far as application processes, your resume, work on it. Um, Work on your resume, put any experience. I think that when we were going through our RHIT program, we were able to do practicums every semester. I put all of those experiences in my resume at the time. So whether I was working in the scanning department, whether I was interning at, hospice department, whatever it was that I was doing, I put that on my resume, because put that all together, that is experience. So um, I would say work on your resume, make sure that you get your certification, make sure that you practice how to answer questions when you start to talk to recruiters. And yeah, just kind of reach out to people that can help you to answer questions.
Thank you so much. Okay, so we have another question. Thank you for sharing, is what Teresa Leung says. And you mentioned that initially you encountered some challenges breaking into the HIM field after you got your associate's degree. In addition to joining an apprenticeship program, do you have any other suggestions on how to enter the field without any experience?
Um, so I would say it used to be a lot easier to volunteer.
Yes.
A lot easier to volunteer back in the days. I understand that the climate has changed now. A lot of organizations don't necessarily want to accept volunteers. So the next best suggestion would be taking a position within an healthcare organization that is going to allow you get your foot in the door. So when people come to me and they're asking me how to break into, I think some of the easiest positions that you can get that can allow you to get your foot in the door would be an HIM tech role or a patient access role. So when you hear the patient service rep or patient access representative, some of those positions, they really are looking for anyone who maybe knows how to use a computer, knows how to be professional, knows about the healthcare industry a bit, and also somebody who is driven. So those kind of patient access positions, HIM tech positions, release of information positions that are relatively easy to get into as long as you have your degree, your education, then I would say take those positions. Once you get in there, once you get into the organization, then you can start looking into the actual role that you want to be in, and start to create relationships with the people that would hire you into those roles. That would be my next best position, is really just kind of starting from the entry level position. Give yourself a goal, a time goal of how long you want to work in that position, and during that time, start creating those relationships with the hiring managers for the positions that you really want.
All right, thank you so much. Okay, the next question, would you say that being a claims adjuster is a great start to making your way in the door for the HIM field?
If you're working in healthcare claims, I would say yes, very much so. Um, if you're referring to like an insurance claims adjuster, um, I'm not, I can't say for sure. It would depend on your education. You can definitely bolster that up with your, if you have some kind of education in the healthcare field, and then you can take some of the skills that you have as a claims adjuster, you know, healthcare claims. Oh, for sure. If it's healthcare claims, that would be a great way to get your feet in the door, because you would be working with billers, right? You work with insurance companies. That is definitely a way to get your foot in the door in HIM. If you work in billing, you would need to know diagnosis codes. You would need to know like the different revenue codes and stuff like that. Start talking to hiring managers in the coding department, start talking to people in the HRM department in general, or any other position, and you can definitely start your way up there.
Okay, thank you so much. Okay, the next question. Would you recommend we obtain the CCS certification if we plan on working in coding? Are the job opportunities more available when you have a CCS certification versus only the HIM AAS degree?
I would say getting a coding certification would not hurt at all. It would definitely give you further leg up if you're trying to get into coding. I fortunately had my RHIT degree. The only requirement to get into the apprenticeship program was to have RHIT. But if you want to maybe give yourself an extra advantage, right? You can definitely work on CCS if you're able to, or do the CPC. You can get your CPC professional coding certification. Put those two things together, you're not going to have a problem getting working coding eventually. So it doesn't hurt.
Okay, thank you so much. We have a lot of wonderful comments about your presentation. And I'm not seeing another question in here. Do we have any other questions?
Good afternoon. This is Dr. Hawkins. Can I jump in, please?
Sure.
And thank you. I mean the students, take us to the classroom where we are right now. Give us some pointers on interacting with our faculty, getting everything I can out of the class while I'm here in this classroom.
Yes. So getting stuff out of your faculty, obviously, for some of us who are full-time faculty members, you obviously have the education and you worked in the field before you got into full-time faculty, so you know everything that needs to be that needs to be known about the healthcare, the HIM field, right? As far as students getting the best out of faculty, I would say that a combination of knowing not just the work, having worked in the field, but also the things that you need to know when you get into the working field. Now is the best time to start asking your professors. So we're not, I would say, the faculty is not just there to teach you, to make you take exams and pass exams, but really there to inspire you, just like Dr. Tyson inspired me years ago. I know that Dr. Tyson, she loved to tell stories while we were in class, but even while she was telling us those stories, that was part of the inspiration. And then I was able to, I would go and ask questions to her. I would be able to, if I wasn't clear in something in my textbook, I would always go to Miss Thoria and ask her to clarify something for me, or I'll go to Dr. Tyson and she would explain to me exactly what the world was out there when you start working. So I would say now would be the time to ask all the questions, not just about the material but that you're studying, but how you can apply that material when you get into the field. I think that for me, because at least for my bachelor's and my master's, because I was working in the field, I was able to connect what I was studying to what I was learning in the class. But my professor, especially for my master's degree, she was a project manager while she was working. So whenever I would be in her project management class, I would ask her not questions about the text, but I would ask her, well, how do you do it at work, right? I would ask her, so as a project manager, this question that you're asking me, how would it actually apply in the real world? So I would probably say just get all the questions out. You know, faculty is here to help you. So I would say your interaction with them should not be solely on the academic piece, but also how you can apply your academic knowledge to when you get into the real world. It could be as simple as asking, well, what, you know, how would this help me in real life, right? Statistics, I didn't like the statistics class while I was working in the field. There was a lot of Excel sheets and stuff like that, and I was like, well, what is the point of this? Well, the point is that you're providing documentation to the Office of Vital Statistics. They need information about patients that are, you know, deceased or that have specific conditions, right? So that is the point to that. Um, so I would say just kind of getting out all of the questions that you have while you're in school.
Thank you.
Yes, ma'am. Thank you.
Okay. So from Miss Williams, we have a comment. I just would like to compliment on how remarkable it was listening to how she set goals and steps and moved higher in her career, and how she continuously wanted more. So here's another question, or a question. How soon can I go into consulting once I graduate with an associate's in HIM and a coding certificate?
Probably, you know what? There are some companies who are really looking for entry level consultants. Um, it doesn't hurt to start putting your resume out there. I would say to maybe, again, if you're not getting responses back while applying for the consultant position, then get a position like a patient access rep, patient service rep, whatever position you can get in the hospital, get it and start applying. I'm not sure a lot of organizations will hire you without any work experience as a consultant, but there are also organizations that will, and then they will train you. I think that it just do a two-step. Apply for positions for in consulting, which is your goal, but also apply for other positions that will get you a more solid foot in the door, which would increase your chances of getting a consultant position. I know people who were on my team at Cerner who were working as a patient service rep for 3 years. Once they get that 3 years experience, they apply for a consultant position and they can get it. And once you get into that organization, then they will train you how to be a consultant. So definitely don't just focus on the consultant position. Just spread your wings a little bit as well.
Thank you. Okay, next question. When you were a team lead, what was your most challenging project, and then what was your favorite project?
Sure. Most challenging project was an upgrade that we needed to do for a system that we use for document imaging. So all of the HIM scanners, you know, we scan tons and tons of records, and they have to perform batch scanning. So we needed to upgrade the system that we use for batch scanning, and we did, and it didn't go so well. The challenge there was that we did not account for downtime, and so it took a longer time to get the system up and running back to the way it was. And we also didn't account for the different clinics outside of the hospital that use that software. And so while we did the upgrade, we didn't know that it had affected them. And so it was challenging because for about 3 days, they weren't able to perform batch scanning. And so they had to start doing point of care scanning, and which is basically taking a small scanner and scanning documents one at a time, which is extremely painful. And so that was a very challenging project for me because it was not, we didn't take into account all of the different downtime and the issues that would happen. But we recovered and were able to get through and fix those issues. My favorite project was probably one that we had to upgrade the case management application in the cloud. So we had to migrate the case management system from on premises to the cloud. That was when my interest into the cloud migration projects actually started. So I really enjoyed that project. And the one that I was most proud of, I would probably say, would be one where I was able to help my coding manager to recover. They were having some problems on the workflow, the work queue for their coders. And so I was able to design a system where the coders actually had their own different work queues. And so that really made it easier for them to code records every day. And because of that, I think their denial rate maybe went down about, I don't know, 15%. And I also was able to save them about $350,000 per quarter because that's how much they were losing because the coders weren't able to code the records on time. And so once I finished designing that system and we went live, they were able to save about 350 per quarter. So that one I was very proud of.
Wow. Well, thanks for adding the third proud of because I left that out. So that's awesome. Thank you so much. Okay, next question. What is the best way to sell yourself, especially since most companies require a bachelor's degree with years of experience for entry-level positions?
Oh gosh, masters? I hope not. Oh, they require a bachelor's degree. Okay, well, and I think that really goes to the point of talking to people who work in the field already and really just being obsessive with um, the different job boards, Indeed, LinkedIn, whatever it is, and reading through the job descriptions that these people are looking for. You read the job descriptions, you match that up with what you've learned, you match that up with with your education and with the work experience that you have, whatever you're doing, and you learn how to talk the talk. Provided you're able to get your foot in the door and do the work, you're going to have to work with someone, reach out to people who are doing what you want to do, talk to them, and practice with them, go through interview rounds, whatever it is, and know how to talk the talk. You talk the talk, you get in the door, and then you go in and do the work. So I think that's really and there are organizations that still accept associate's degree. I think baseline now, a lot of people are looking for bachelor's degree, but if that is a goal for you, then just get on the goal and get your bachelor's, or if not, you just practice.
Thank you so much. Okay, next question. What was the hardest part of your education? Your associate's, bachelor's, or master's? And probably why?
I think it was probably the master's because I was then I had so many different projects that I was working on at the time at work, and the master's is the master's. The content was a lot harder for me compared to the associates and the bachelor's, but also because of the time that I didn't have. So I would probably say it was the master's. And it was simple because I would be working on Pacific time, Eastern time, Central time, 4 days out of the week. So, and then I was also having to study material that I was not used to. So I was learning data visualization. I was learning um, survey, how to build a system and user design, and also research. So those are some of the topics that I hadn't been exposed to previously. So
Well,
Miss,
I guess
Miss,
oh,
I'm
sorry.
sorry, Dr. Lambert, may I add something?
Oh, please do.
Miss Amona, would you put up your last slide again, please? And this is what I got out of what Miss Amona was saying. I like going to Galveston and hanging out in Galveston, and I like going the back road. I like going through Freeport, Surfside to get to Galveston. But there's a problem with getting from Freeport, Surfside over to Galveston. And that is Galveston is an island. And the way you got to get onto the island from Surfside is you got to pay a toll. You can't get there for free. You got to pay a toll. So what Miss Amona just showed us was, as she went from each one of these islands, and she has 7 islands here on her screen, she had to pay a toll to get from one island to the next island to the next island. And as she paid this toll to get from one island to the next island to the next island, she went up, and you see it right smack dab in the middle. She shows herself going upstairs. So every time she went to a new island, number one, she had to pay a toll. It wasn't free. She had to invest in her education. She had to invest in time. And then she was able to progress. So she couldn't get to Deloitte without having gone through HCC. She couldn't have gotten to Cerner without having gone through Simmons. So you have to pay the toll, and you got to do it step by step. If you're working on your associate degree, you're not going to get to Deloitte tomorrow. It ain't going to happen. You first have to put in the dues. And if you get one of those, somebody offer you a job that you think is beneath you, take the what you think is beneath you job and be extremely grateful to the universe, to God, to the person who gave you the job, and take it and do the best you can, because that's going to be your toll to getting to your next island.
see, now those are the kind of stories that Dr. Syson's holding class, and that's why I'm here today. So thank you for demonstrating what I talked about earlier.
Everything has a cost. And what's really cool about it is that y'all are sitting here right now, and this is part of the cost. Everybody is not going to log in at 6 o'clock at night when they can be watching, well, for me it would be like The Bachelor, watching some stupid show or housewife show. But instead, y'all are sitting on a Zoom call, listening and sitting at the feet of a person who has got what you want, and you're getting this from her, and she's showing you this is my journey. And she told us at the beginning, your journey ain't going to be like my journey. She said, this is my journey. So if you take some of her journey and some of what Ms. Gonzalez told us last week, and you mix it up with your journey, every raindrop is unique. Every snowflake is unique. You're going to be your own snowflake. You're going to be your own. So I'm telling you, what Miss Amona told us today, this is gold. Well, okay, today's gold is Bitcoin. She gave us Bitcoin tonight. Okay, so we need to take this Bitcoin that she gave us and use it for our benefit. Thank you so much, Miss Amona, for sharing your wisdom with us. I'm gonna do another dream board. Thank you. I'm getting the stuff and start working on my dream board again. Thank you so much for sharing.
Indeed. Thank you. Thank you so much, everyone.
Thank you. We look forward to your doctorate journey.
Oh, Lord, don't be my father is asking me